SHPA's Don't Rush to Crush is Australia's essential guide to safely giving oral medicines to people with enteral feeding tubes or swallowing difficulties. It is a comprehensive reference for Australian pharmacists and nurses to support best clinical practice, and it is a Pharmacy Board of Australia required text for pharmacists. For pharmacists, Don't Rush to Crush will help you make sure that the medicine provided is safe and appropriate for your patient or customer. For nurses, it will help you safely prepare and give a medicine to a person with an enteral feeding tube or a swallowing difficulty. This presentation will show you the information that is available in Don't Rush to Crush, plus we will show you the new features in this latest 4th edition. Don't Rush to Crush is made up of 2 sections, a front section that contains important general information and an alphabetical list of monographs. Each section of information about one medicine is called a monograph. The front section contains general information about things to consider before you modify a medicine, why crushing is always an option of last resort, how to interpret the information in the monographs, and how to prepare the medicines for people with enteral feeding tubes or swallowing difficulties. Most of the monographs are listed alphabetically by active ingredient name, but at the back of the book there is a separate section for antiretrovirals or HIV medicines and the hepatitis C antivirals. Now let's look at a monograph. This is the monograph for escitalopram. A list of all the available forms and strengths is given here, including the brand names. The quick guide section includes icons that give you a clue as to what options might be suitable for each form of the medicine. The quick guide might also warn you if the medicine poses a potential occupational hazard. You can see that escitalopram is available as a liquid and a tablet, and we have 3 icons here, one for the oral liquid, one showing the tablet dispersing in water, and one for crushing. Each icon corresponds to a specific method of preparation, and you can find a detailed explanation of each icon in the front section of the book. The monograph provides information about the medicine that might be relevant to people with enteral feeding tubes or swallowing difficulties. This section of the monograph will tell you how food affects the absorption or tolerability of the medicine, where the medicine is absorbed, safe handling advice, and information to help you if you have to switch dose forms, for example, switching from a modified release tablet to a plain tablet, or from a tablet to a liquid, as well as if there are other forms available like a transdermal patch or an injection. There may be relevant side effect information here too, like some medicines that cause dry mouth, which can affect swallowing ability, as well as information about what might happen if the drug is stopped or if a dose is missed or delayed, and this can sometimes happen if it takes some time to work through the best options for a particular medicine for your patient. Each monograph gives 2 sets of options, one for people with enteral feeding tubes and one for people with swallowing difficulties. For escitalopram, there are 3 options for people with enteral feeding tubes and also 3 for people with swallowing difficulties. The options are listed in order of preference. However, it is up to the individual to decide what will work best for the person in your care. Options are not always the same for enteral feeding tubes and swallowing difficulties. An oral liquid is usually the best option for a person with an enteral feeding tube. Directions are given here to dilute the dose with water, and this is because most oral liquids have a high osmolarity and they will cause cramping and diarrhea when given directly into the tube. Diluting them with water reduces the osmolarity and makes them better tolerated. Some liquids are a bit thicker than water, so diluting them will also help the liquid pass through the tube without clogging it. Option 2 is to disperse the tablet. That means placing the tablet in 10 to 20 ml of water in an enteral syringe and allowing it to break up into a dispersion with gentle shaking or stirring. There is information about how long different brands take to disperse. Method A is a step-by-step list of instructions that show you how to disperse a tablet for administration into an enteral feeding tube. There are 6 different methods of preparation and administration described in Don't Rush to Crush, and you can find them listed here on this handy insert at the very front of the book. Always make sure the tablet is completely dispersed before giving it into the tube, because pieces of the tablet can block the tube. Gently shake the enteral syringe to make an even suspension just before you give the dose. Option 3 is to crush the tablet and refers you to Method B, where step-by-step instructions are provided. Crushing is usually the last option. Dispersing a tablet is usually recommended before crushing because you lose more of the dose through crushing. If a tablet doesn't disperse easily, or if we don't have any information about dispersibility, then it may be necessary to crush it. Make sure you rinse the crushing device twice and rinse the enteral syringe so you get as much of the dose as possible to the person. By flushing the tube before and after giving the medicine, it will help avoid tube blockages. One of the biggest risks with any modification of a tablet or capsule is not getting the whole dose. Even with the best technique, some of the dose will be lost to the equipment, and it can be as high as 24% if technique is poor. So regardless of which option you decide is best for your patient, make sure you follow the instructions as they are set out in the methods. Sometimes, a particular medicine will need a larger volume of water to disperse the medicine or flush the tube than what is advised in the methods. These details will be provided in the individual medicine monograph. An example of this is esomeprazole. Here you can see that the recommended volume is more than in Method A, and it varies depending on the size of the tube. There is a high risk of tube blockage with all the proton pump inhibitors if not enough water is used to prepare and give the medicine. In this case, if the recommended volumes are too large for the person to tolerate, then there is another option, and in this case it is better to switch medicines if you can, rather than risk a tube blockage. If we go back to escitalopram, the options for people with swallowing difficulties are in the same order as those for enteral feeding tubes, but the information is different. Oral liquids are usually a suitable option, but some people with swallowing difficulties or dysphagia won't be able to safely swallow a liquid medicine. For people with dysphagia, thin liquids like water, tea and coffee are particularly challenging to swallow because of the speed and unpredictability of the direction of flow. A thicker liquid flows more slowly and gives the person more control when swallowing. If a liquid is too thin for someone with dysphagia, it can be aspirated or inhaled into the lungs, while food or liquids that are too thick or too sticky can cause choking. Oral liquid medicines are thickened to different degrees. To improve safety for people with swallowing difficulties, there is a new standard to describe the thickness and texture of food and drinks. It's called the International Dysphagia Diet Standardization Initiative, or the IDSI framework. IDSI identifies 4 levels of liquid thickness, from level 0 thin, like water, to level 4 extremely thick, like some purees and yogurt. Levels 5 to 7 relate to food. Most people with dysphagia cannot safely swallow a level 0, 1 or 2 liquid. So for this edition of Don't Rush to Crush, we tested all the liquid medicines to see how thick they are and whether they are a suitable recommendation for people with dysphagia. What we found is that almost half the liquid medicines are a level 2, which is mildly thick, and the rest are either level 0 or level 1. None of the medicines were thicker than level 2, and this means they won't be a safe option for many people with dysphagia. So with this in mind, There are other options provided for people who can't swallow thin fluids. In the case of escitalopram, the liquid is a level 0, so it's thin like water, but it can be mixed with a spoonful of yogurt or apple puree. Option 2 is to disperse the tablet in water, and option 3 is to crush. If you look at the methods, you will see the step-by-step instructions are slightly different to the methods for enteral feeding tubes. This edition also includes a new recommendation for people who can't swallow thin fluids. We looked at oral liquid medicines that are usually given in small volume doses, like prednisolone, and we tested whether they could be added to a medication lubricant. At the time of testing, Gloop was the only TGA-approved medication lubricant available, and it had already been tested against the IDSI standards. There are 2 formulations. One is an IDSI level 3 and one is an IDSI level 4, so we know that these will be suitable for people who can't swallow thin fluids. We found that small doses of oral liquid medicines, or a tablet that disperses in a small amount of water, and by small we mean 1 ml to 2.5 ml, could be mixed with 2 pumps of Gloop without altering the thickness of Gloop. This is a new recommendation in this 4th edition. For example, up to 1 ml of prednisolone oral liquid can be mixed with Gloop, and 2.5 ml can be mixed with Gloop Fort. Another new feature of the 4th edition is a section about gastrointestinal dysfunction. This is for people who may have normal swallowing ability, but they may have had bariatric surgery or a tumour resection, or they may be critically ill, and that means that their gastrointestinal function is altered, and this can affect the absorption of medicines. This edition doesn't give specific advice for each medicine, as there are too many individual patient and surgical factors to consider, but the monographs provide useful information for your patients who have altered GI function. This includes the availability of different formulations, the sorbitol content of medicines, because too much sorbitol can cause diarrhea, especially in a person with a shortened GI tract, advice about dose changes if you have to switch formulations, monitoring that might be required, and where a medicine is absorbed. So there's a good amount of information there that can help you make recommendations based on the individual situation and the medicines. Don't Rush to Crush also contains a handy set of tables that compare medicines by drug class. These tables provide a summary of which medicines within a therapeutic class are physically suitable for giving into an enteral feeding tube or to someone with swallowing difficulties. A green tick means there is a form of the medicine available that suits this administration, for example, an oral liquid or a dispersible tablet. A grey tick means a suitable form is available, but more manipulation is required, for example, crushing a tablet. And a red cross means it's not suitable. The proton pump inhibitors and ACE inhibitors are good examples of where the tables can help guide selection of the best medicine within a class for your patient. Remember, the tables are just an overview of a therapeutic class. Always check the individual medicine monograph as well, as there may be information there that is relevant to the individual patient. You may have patients or customers who are managing the crushing or dispersing of their medicines at home, or even managing at home with an enteral feeding tube in place. Here at the front of the book, we have added a link to a patient leaflet that you can print out and hand to your customers, giving them step-by-step instructions about crushing and dispersing medicines in plain language. This can help make sure that they are getting as close as possible to the entire dose. And for people who may have different carers giving their medicines, it will help ensure the medicines are prepared and given the same way each time. The 4th edition is the latest version of Don't Rush to Crush. It is not safe practice to use out-of-date references or guidelines, so make sure that you have access to this latest edition of Don't Rush to Crush. Look for the large number 4 on the cover. To purchase, visit shpa.org.au/bookshop.